Hello, good morning. My name is zarrin. Did you know that approximately 111,000 Australians are diagnosed with a heart failure every year? Heart failure is a serious condition which accounts for the second most cause of hospital admissions. Let's start with the definition of heart failure. Heart failure is a pathophysiological condition where the heart cannot generate adequate cardiac output, causing a reduced tissue perfusion. Heart failure is usually suspected due to the presence of certain symptoms, which are a result of heart's attempt to compensate for the decreased cardiac output. Throughout this presentation, I will be discussing the pathophysiology of clinical manifestations seen in Mrs. Brown due to her history of heart failure. Tachycardia, high blood pressure, dyspnea and hypoxemia, tachypnea and lung crackles, atrial fibrillation. Tachycardia. When there is a decrease in cardiac output, the sympathetic nervous system gets activated to compensate for the decreased tissue perfusion. This decreased cardiac output causes a decrease in blood volume as well, which is identified by the baroreceptors in the central circulation. The sympathetic nervous system stimulates the beta receptors of the heart, causing it to beat faster and with greater force. Increased heart rate is presented as a tachycardia in Mrs. Brown with her heart rate being 120 beats per minute. High blood pressure. Activation of sympathetic nervous system is also responsible for Mrs. Brown's raised blood pressure. Sympathetic nervous system releases adrenaline into the body's circulation, which causes constriction of blood vessels to increase venous return. This will further increase the total peripheral resistance, bringing an increase in blood pressure. Vasoconstriction of renal blood vessels decrease the blood to the kidneys. Kidneys try to compensate for this decreased blood flow by activating the renin and angiotensin aldosterone system. These hormones increase the blood pressure by direct vasoconstriction and by salt and water retention. When blood pressure falls, this is detected in the kidneys and renin is released. Renin activates angiotensinogen, a hormone secreted by the liver, to angiotensin 1, which is converted to angiotensin 2 in the pulmonary circulation by angiotensin converting enzyme. Angiotensin 2 increases vasoconstriction, which is in turn increase the afterload and blood pressure. Aldosterone brings about sodium and water retention and therefore raise blood volume. Blood volume increase the preload, which further increases the blood pressure. Dyspnea and hypoxemia. Mrs. Brown is also expressing dyspnea, which is a result of fluid retention in the lungs. Due to the neurohormonal mechanism, as previously explained, blood volume is increased. However, heart is unable to pump all the blood out, which causes it to backflow in the lungs. As pulmonary venous pressure circulation starts backing, it increases the pressure in the pulmonary veins, which eventually increases the pressure in the pulmonary capillaries, and that leads to pulmonary edema. This edema increases the diameter of pulmonary capillaries and decreases the ventilation. Improper ventilation does not allow for enough oxygenation as it runs through the system, which leads to lower oxygen saturation or hypoxemia. Lung crackles and tachypnea. The fluid filled in the lungs does not allow proper opening of the bronchioles on inhalation. The bronchioles attempt to open produces a specific sound when osculating the lungs, which can be presented as rales or crackles. Lung congestion along with activation of the sympathetic nervous system also raised Mrs. Brown's breathing. This was also an attempt to increase tissue perfusion, which is why she is tachypneic. Atrial fibrillation. Atrial fibrillation refers to inability of the atria to contract properly, which can happen due to atrial enlargement, fibrosis, or molecular abnormalities leading to ionic imbalances. In conclusion, it is evident that the clinical manifestations presented in patients with heart failure are result for the heart's compensatory mechanism to make up for the reduced cardiac output, resulting in decreased tissue perfusion. Therefore, as nurses, it is vital for us to understand that heart failure is a critical condition which requires immediate intervention to enhance our patient outcomes. Thank you for watching this video.